So this is very, very interesting issue. We also addressed, but at the beginning, what I would like to emphasize is that patients already in TFR, they all don't feel happy as is expected maybe by some experts and all patients. It was very nice work published by patients themselves in leukemia a couple of years ago, led by Giora Šarf. They showed that more than 50% of patients already in TFR reported fears, anxiety, depression, and also when they had to reinitiate TKI therapy due to molecular recurrence. So we were inspired. So we designed a survey called anti-half, complementary to our nationwide stopping trial half, and the data are already published in Leukemia last year. So we found that almost 1/4 of truly eligible patients were not willing to attempt TFR, even in the trial where the dose reduction is, or the discontinuation is done gradually. And their main reasons were, again, fears about molecular recurrence, concerns about less effective retreatment. And what was interesting, that it was even though they expressed high level of satisfaction with information about half trial, and in Czech Republic the CML patients care is centralized, so usually patients are with one physician, also like a half trial investigator in one person, so the communication should be perfect, almost perfect. So it was very one interesting point. And another findings coming from multivariate analysis show that for instance, patients who were less educated and patients who were retired, disabled, or unemployed, they were more reluctant to participation in the trial. So another, important implications for improvement of our discussion with patients. We have to use proper vocabulary, etc. But what was the most prominent finding or the biggest barrier? It was logistical issue, because there was the strongest parameter that the longer travel to the hematological center was the most prominent barrier. So something which is beyond our control, which we can't change. So maybe this will be the main result from our trial, that some kind of dose optimization would be the best, like a middle ground or something like this, between the full dose lifelong therapy and the abrupt treatment discontinuation.